Well, now I'm joined here in the studio by Dr. Bharat Pankania, a clinical lecturer at Exeter University and a former consultant to Public Health England. And from Beaconsfield, we have Professor Carol Sikora, who was chief of the cancer programme at the World Health Organization and is now Dean of Medicine at the University of Buckingham. And in Westminster, we have Dr. Dominic Pimenta, a frontline NHS doctor and cardiology registrar. And inevitably, we're going to come to you, Dr. Pimenta, first. And I'm wondering what your reaction as a frontline operative right now, dealing with people coming in every day, what you feel about today's measures.
That's a great question, John. Thank you very much. So the reason I'm here today predominantly is because this morning and this afternoon we've published a letter.
Essentially cocooned. I think this is unnecessary. One has to be reasonable. What one's trying to do is increase the disease burden, as we've heard on the health service, by allowing people that are more likely than not to get into trouble if they get infected. People with pre-existing heart and lung disease, people that have other problems. They're the people that really need to be careful. And remember, a healthy 70-year-old is probably at lower risk than an unhealthy 50-year-old. So age is not a good criteria here as the only criteria.
Dr. Pankania, then where are you on this?
I'm with a bit of both, with both my colleagues here. But what I would say is this. Clear messages need to be sent to the at-risk groups. Professor Sikora has identified that you can be lower than 60 years old and have at-risk conditions, and this needs to be articulated clearly. And people like myself, many of my colleagues have been talking about, the clear messages that need for people who need to isolate and isolate as soon as possible. On the subject of testing, we're very concerned because by not testing in the community, we're losing precision on our cases, our knowledge of the cases, and maybe identifying specific hotspots and a lot more other things besides.
Well, now, let me just ask you then, Dominic Pimenta, because France on Wednesday is going to actually lock people in their houses, effectively. It's going to order people to remain indoors and for 30 days. Is that what you want here?
I want to hear that the government is taking any measure, and by that I mean any measure, that will reduce the number of cases coming into hospital. And we're talking about a virus with a 2-week incubation period, so anything we do today will not have any effect on the spread for another 2 weeks. We have to bear that in mind as the cases rise exponentially. The government could be doing a lot more, not only banning mass gatherings, but actually enforcing that ban, not only asking for self-isolation in a few weeks' time, but today, but also providing infrastructure to make that self-isolation sustainable, making sure that there's elderly care, there's food deliveries. They need to do a lot more, almost on a wartime footing, to support that to actually be feasible.
As you are on the front line, I mean, just give us a sense of what is confronting you every day.
So it's gone rapidly from everybody being almost sceptical that this would even happen, to suddenly it happening straight away. It's been very, very sudden. We're trying to make as much as we possibly can on the front line, preparations, and literally plans are changing every single day. As I said, we're already running out of the basic protective kit for us as NHS workers, which is our main concern. And if we start losing frontline staff in a country where we already didn't have very many frontline staff, and we haven't organised any more frontline staff, we're going to run into trouble very, very, very quickly.
Professor Sikora, is this thing under...
From 1,200 NHS frontline staff who are calling for the government to take drastic measures to reduce the amount of cases coming into hospital as small as possible so we have the capacity to cope. The measures announced today are a step in the right direction and somewhat vindicating our concerns, but they don't go, in my opinion, far enough. What we need to do is achieve the amount of cases coming in that we can safely deal with. Already we are running out of protective masks and goggles, and the crisis hasn't really even begun yet. There's a long-term shortage of ventilators and even of oxygen. What we need is time to prepare, resources to protect ourselves, and we need to return to the World Health Organization recommendation of mass testing so we can reduce the numbers as much as possible and save us time, because that is the key thing that will get us through this. We don't have the time to prepare and we're not ready.
Professor Sikora, what's your reaction to that reaction from the front line?
I think that's a reasonable reaction. The difficulty is the practicality. If you really do really draconian measures, close everything, absolutely close, prevent people getting out of their houses, especially those at higher risk, people with comorbidities, multiple illnesses, and elderly people, it'll be difficult to police. So it's got to be a reasonable balance. And I think what we've heard so far has been great. I was very worried on Sunday morning when I heard that the over 70s, I'm 71 myself, were going to be...
Control, or are you concerned that it is out of control?
No, I think it's under control. I think we'll get through this. By June, it'll get a lot better. The evidence from China and Korea is that it's not great there in either country, but it's got a lot better in the last week than it was before. And I think the same thing will happen in Italy, France, and then us. And we have to get through it. And
you've mentioned Korea in particular, which seems a very, very interesting example, but it's very difficult to tell why they've been so successful.
I guess because they're better organized than we are. And do the health service, some countries have more capacity in the health service than we do. We don't have that capacity.
What do you make of it?
I'll tell you, while Korea has succeeded, it did extensive testing, extensive restriction of movements early on. As soon as it happened, Korea went for it and said, we're going to test, we're going to identify who is at risk, and then you stop the contacts of the cases.
That assumes they had the testing kits and the rest of it. We seem to be short of testing kits,
no, we are
short of ventilators, short of more or less everything.
We are not short of testing kits. We may be short of other things. But my main point is this. If you stop the rising tide, you will create fewer cases for my colleague over there to handle. That is all I'm saying. Please lower the rising tide of number of cases. And therefore, whilst we may be saying draconian measures for people to go into isolation in the at-risk groups, it is a good thing because they are the ones who are most vulnerable should they get infected.
Thank you very much indeed. Well, thank you, Dr. Pankania, thank you, Dr. Sikora, and thank you, Dr. Pimenta, and good luck on the front line. Thank you.